Okay.
I'm Megan, and I am performing enteral feeding today. And this is Devin, and she's recording for me. I'm going to knock on the door. I'm going to walk in, introduce myself, verify the patient with 2 identifiers. I'm going to explain the procedure to my patient. That's what we're going to be doing today. Okay. Perform hand hygiene. I'm going to oscillate for bowel sounds. I'm going to measure abdominal girth of my patient. I'm also going to obtain a baseline weight for my patient and go over their lab values, as well as assess for fluid volume deficit, as well as fluid volume excess and deficit, as well as electrolyte abnormalities and metabolic abnormalities, such as hyperglycemia. I'm going to verify the physician's orders for formula, rate, route, and frequency, as well as flush amount and frequency. Flush amount and frequency. Okay. And I am going to...
It is. It's just a different way of doing it.
Flush amount.
And then you have to push it to different
frequency. And for patients with an abdominally inserted feeding tube, I'm going to check the insertion site for drainage, breakage, irritation, drainage discomfort, all that sorts of stuff.
And I used to do this, but I've been learning.
I'm going to come over here and I'm going to measure out 30 milliliters of water. For my intermittent feeding. And for the formula, I'm going to check the expiration date of the formula as well as the integrity of the container and make sure that the formula is room temperature and make sure that I shake it really well.
That's it. Is a label, yeah. In most places don't do it.
Verify the patient again using 2 identifiers.
And you're treating in a regular.
Going to perform hand hygiene.
Obviously, and that's why you want
I'm going to raise the bed to a high fowler's position of at least 30 degrees.
So that's why I would put something more expensive. Yep. You can put it. The other thing too is I would get the ready. So take that out of the package.
I'm going to drop 10
I take the top off.
to 30 milliliters.
I kind of, I loosen the IV, kind of loosen it and pull it away from that, just because sometimes it sticks. Once you know that it's all good to go, kind of thing, then lay it back in there. And how do you, which way is the bevel when you start out? You see the bevel on there, you know what I'm talking about, the hole.
Is it bevel up?
Bevel up, yes. Always make sure bevel up, because that will give you the best blood return. So you can see the little hole there and stuff. Are you all set, babe? You want to put it in Lisa's box? Yes. Did you sign it? Yep. Okay. Yep. So then, make sure you have that up. And that loosening.
And now I'm going to draw back until I feel resistance of the aspirated content.
That will be your needle retractor.
30, and I'm going to assess the amount of the aspirate as well as the appearance of it. And I am going to return all but 1 milliliter of the aspirate.
And the other thing, when I see you do that, I find if you put your needle this way, it really keeps everything out of the way. If you do this, your fingers are kind of in the way, you might be at the wrong angle.
And I'm going to make sure that I am assessing the residual volume before feeding for intermittent feedings and every 4 to 6 hours for continuous feedings.
The veins lay flat, right? So when you are serving it, if you typically need a little high to go in, what are you going to do? You're going to go right there. So the reason that you lift it is just enough to pierce this vein. Once you pierce this vein, it's just enough to lift. Lay it down. Lay it fast against the back of the vein.
would actually, right now, I would pull back 10 to 30 milliliters of
And I have to make sure that whenever I'm not feeding, I'm going to clamp the proximal end of the feeding tube and clean the syringe, the bag, and the tubing whenever feeding is interrupted, and use a new administration set every 24 hours. I'm also going to make sure that I clean the insertion site with warm water, washing, rinsing, drying, and see if there's an order for a breathable pad for the insertion site, because this area can be left open to air. Okay. Now I'm going to remove my gloves, perform hand hygiene, reapply gloves. I'm going to provide oral care. And I'm going to remove my gloves from hand hygiene, put my gloves on. I am going to instruct the patient that it is important for them to stay in a high Fowler's position for the next 30 minutes, as well as evaluate my patient for their lab values and their respiratory rate and their current level of comfort. And I think that is it.